to my YouTube channel. It has been a while, but yes, here I come. Today is going to be a different day. I'm going to introduce about a topic some people don't really like, but it's one of the most important topics that has led our loved ones leave us, because people really know little or nothing about it. And this topic is going to be an emotional topic. But as I sat down, I made research. I was like, let me make about this topic, because very many people don't really know about the topic. And today's topic is going to be cancer. What is cancer? Cancer is a disease. We all know that cancer is a disease, but we don't really know what cancer is it in depth. So cancer is a disease in which abnormal cells divide uncontrollably and destroy body tissue. According to the scientists, according to science, that is how cancer is defined. A disease in which abnormal cells that are not functioning properly, divide uncontrollably and destroy body tissue. Hope you guys have really gotten what the definition of cancer. So my next concept is going to be about types of cancer. There are very many types of cancers. So let us look into those types. First of all, we have breast cancer. People know about this cancer, but they don't really know what it is in depth. And we all know that this cancer is mainly seen in female, but people don't know that this cancer can also attack the males, and it is more deadly and more dangerous when it attacks the males. So we have breast cancer. This type of cancer is for both male and females, though it is commonly seen in females. It forms in the cells of the breast. So this cancer forms in the cells. It destroys the cells of the breast. And you know how people don't really care about the breast, you just put on your bra, anything. But when it attacks a person's breast, it is really dangerous, and we are going to also look into that. Another type of cancer is the cervical cancer. Cervical cancer develops in a woman's cervix. We know that the cervix is the entrance of the womb from the vagina. That's how scientists really define the cervix. It mainly affects sexually active women aged between 30 and 45 years. Though people like girls who are teenagers, who are in their 20s, you should also go for tests, and you can go for the injection to prevent the cervical cancer. Cervical cancer is really deadly, and it can lead to barrenness in women. So you have the prostate cancer. This is the cancer in a man's prostate. We have the prostate gland. It is a small gland that produces seminal fluids. This cancer attacks old men from the age of 45 and above. So if this cancer develops at an older stage, when a man has not realized it early, it can lead to an operation, and they remove the prostate gland. We shall go into the causes of the prostate cancer. We also have the liver cancer. Liver cancer is a cancer that's found anywhere on the liver. So people are advised to go for general checkups, though some people don't really want to do those general checkups, but it is really important for a person to go and they test every organ of the body. So another type of cancer is called the lung cancer. This is very common. This is the cancer that begins in the lungs and most often occurs to the people that smoke. You know how smoking, we all know that smoking leads to what? Cancer. The cigarette has dangerous substances rather. It has dangerous substances. We have tar, we have nicotine. Those substances are so deadly to our lungs. That is why when someone has a cigar on the packet, there is too much smoking leads to cancer. But because someone is addicted to smoking, they would just ignore that disclaimer. They would just keep on smoking and smoking. When you overdo smoking, it can lead to what? To lung cancer. Though we have two types of smoking. We have the active smoking and the passive smoking. Active smoking is when a person is getting the cigar and is he or she smoking what? Directly. But passive smoking is when you're smoking in the public and the smoke, we know how smoke can we know how the smoke can really move so fast, and it affects also other people. So when they inhale that air, the smoke, the substances in the cigar, the nicotine and tar, they inhale in the smoke, which can also affect them. So that is called what? Passive smoking. And passive smoking, science says it is more dangerous than active smoking. That is why public smoking, for example, smoking in cars, smoking where people are, is really not good at all, and it is prohibited. So we have leukemia. What is leukemia? A cancer of blood-forming tissues, hindering the body's ability to fight infection. This is the blood cancer. So you can go in the hospital, you have a relative, he or she has leukemia. That is called blood cancer. We have this, you know how difficult these science words are, but we have lymphoma, a cancer of the lymphatic system. We all know that the lymphatic system contains the white blood cells that fight against disease causing cells in the body. So when the lymphatic system is affected by that cancer cell called lymphoma, you can get, rather, when the body is affected by the cancer cell called lymphoma, one's lymphatic system is going to be put down. Like the white blood cells are going to be so weak to fight any disease in your body. That is why people with lymphoma, for example, if you get malaria, it is going to be so severe, and that cancer is really deadly. So you have the skin cancer, a cancer that affects the skin. So we all know that skin cancer is the cancer of the skin. So let us go into the causes of cancer. Very many people don't really know what causes cancer. Number one, we have the chemical or toxic compound exposure. Chemicals such as benzene, chloride, tobacco or cigarette smoke, which we said it is nicotine, oil, and tar. So these chemicals, we've seen that the nicotine and tar lead to what? To lung cancer. So the chemical or toxic compound exposure, those chemicals are really deadly. If you're going to take something, first look at the chemical composition in that thing. Is there benzene? Is there chloride? Please be careful while taking those substances, because when they have those chemicals, it will lead to the exposure of what? Of cancer. So you have ionizing radiation such as uranium, ultra rays from the sun, radiation from alpha, beta, gamma, and X-ray emitting sources. X-ray emitting sources, for example, people who overgo into who overexpose their bodies to X-rays. When you go, in fact, what the doctor first asks you, how many times have you carried out an X-ray? There is a limit. If it's more than that, they will tell you, no, we're not going to do another X-ray, because there are those the emitting rays that are really deadly to the body. Then you have the direct sun. So when, for example, the people who are suffering from albino, that's why they always, for example, they always cover their eyes, they always smear themselves with some cream to protect the sun to go to their skin directly, because when someone is exposed to too much sunshine, he or she may end up getting cancer. So another thing is pathogens. What are pathogens? Pathogens are disease-causing viruses, bacteria, fungi, which can infect animals. So pathogens can also lead to what? To cancer. So we have genetics. For example, if your grandmother's mother had cancer, the genes of anywhere in one of your family member, you that's why you end up hearing someone has cancer because their father's father had cancer. So that genes, a gene is also a cause of cancer. So we have red meat, such as beef, lamb, and pork. Eating a lot of barbecue meat may also increase the risk due to the compounds formed at high temperatures. We all know that doctors tell us you're not supposed to eat too much meat, you're not supposed to eat too much pork, you're not supposed to eat too much of the red meat. Rather, eat vegetables, eat fruits, eat those things. For example, if you're going to eat meat, eat it like once in a month, twice in a month, but not every day. Some people's families, they eat meat Monday, Tuesday, Wednesday, Thursday. No, that can lead to what? To cancer. Eat vegetables. If you eat meat on Monday, eat the meat after like 3 weeks. But because people think eating meat every day is prestigious, they end up eating it every day, but they don't know the effects of what? Meat. So you have cell phones. Though this is not yet, they're still researching about cell phones, but according to the World Health Organization in 2011, it classified that cell phones are low energy radiation. So people who overuse cell phones are also at the risk of getting ear cancer. So you find a person Monday to Friday, they are listening to music every day using earphones in their phones. It is not good for their body. So let us look at the signs and symptoms of cancer. For the breast cancer, it may present a lump in the breast. Someone can also get nipple discharge. Though not every lump in the body is a sign of cancer, but lumps that are painful, you're supposed to go immediately to the doctor for a checkup. Then when you see nipple, like something coming out of your nipple, the white yellowish substance from your nipple, please seek attention. Go for checkup, because those are signs and symptoms of what? Breast cancer. Note, a few patients show no signs or symptoms until the cancer is far advanced. That is why we are advised to go for checkups. For example, you've seen very many people who say that I didn't have anything, I didn't have a pain here and there, but when I went in the hospital, when they checked me, they found out that it is what? It is cancer. So once in a while, I know it is so scary for a person to go for checkups, but once in a while, please go and do checkups and see your status. So we have Change in bowel or bladder habits. This is a sign and a symptom of prostate cancer. A man can urinate frequently. A man can urinate with blood in their urine. So please, when you see change in bowel or bladder habits, please go for checkup. So you have a sore throat that does not heal. That is a sign of throat cancer. For example, you're coughing every day. There is a sore throat that is not healing. That is also a sign and symptom of cancer. Unusual bleeding. This is a sign and symptom of cervical cancer. Unusual bleeding. Then we have thickening of a lump in your breast and testicles. This is a sign and symptom of breast and prostate cancer. So yeah, if you have a friend who has such signs and symptoms, please let's spread love by telling those people to go for checkup in very many in hospitals. So let us look at the specialists who treat cancer. We have the oncologist. This is the surgeon. For example, you've seen those people with cancer, about those who go for operation. So the person who works on them is called an oncologist. So we have the radiotherapist. This is the specialist who deals in radiations. Then we have the chemotherapist. This is also, you can call them a medical oncologist. So we have three specialists who treat cancer. We have the oncologist specialist in radiation, who is also known as the radiotherapist, and then a chemotherapist. So those are the three specialists that deal in cancer. So we have the complications, stroke effects of cancer. Fatigue. This is caused due to cancer and its treatments. You know how someone has to swallow very many tablets. So due to that, one can get fatigue. We have anemia. We have loss of appetite. We have insomnia, lack of sleep, hair loss due to treatment, and this is because of the chemotherapy a person has, because when you're going through that chemotherapy, they have to chop off your hair. Then you have nausea, feeling to vomit, pain. This is so sad that cancer, we all know, it leads to death. Please let us not take cancer for granted. It is such a deadly disease. We have seen very many celebrities, we have seen very many important people in our lives that have passed on due to cancer. And too bad that they discovered that cancer in its last stage, which is too difficult to treat that cancer, and more so it is costly. So let us do whatever we can to prevent cancer, and what I'm going in is how to prevent cancer. Number one, we have avoid smoking. Please avoid smoking. However addicted you are, please avoid smoking, because it has substances such as tar and nicotine that can lead to cancer. Avoid excess sunlight by decreasing exposure or by applying sunscreen. For example, there is a cream that someone can smear to avoid direct sunlight. You can put on glasses to avoid eye cancer. Avoid contact with viruses and other pathogens. People who have to work close to cancer-causing agents such as chemical workers, X-ray technicians, and ionizing radiation researchers should follow all safety precautions and minimizing exposure to such compounds. For example, if you're working in an X-ray, you're supposed to cover yourself very well because of the radiations that are emitted. They are not good at all to our bodies. So avoid going into an x-ray without covering yourself with something that can really protect you. Eat plenty of fruits and vegetables. Base your diet on fruits, vegetables, and other foods from and other foods. For example, eat fruits such as oranges, watermelons, pineapples, any fruit you feel like, but avoid eating meat every day because red meat can cause cancer. So eat plenty of fruits and vegetables to avoid cancer. There are very many ways to control or prevent cancer. For people who usually use like phones and stuff, at least use earphones because they do have filters in them that can control the direct sound, music and stuff. Most of for those who usually listen to music. There are very many ways of controlling cancer, and there are various ways of preventing cancer. So hope this video has been helpful, and hope this video will help in the prevention of cancer. And for those that have really lost their parents, all friends, all what, because of cancer, may their souls rest in peace. Let us join together in the fight of cancer, because cancer is a deadly disease. Tell a friend to subscribe to my YouTube channel, because more and more is coming. Share the video, subscribe, like the video, and tell a friend to subscribe to my YouTube channel. Thank you. We'll see you in another video.